Can you guys hear me okay? Way back there? Brilliant. Oh, thank you very much for inviting me to come and speak today. It's a real pleasure, and especially the topic is fantastic. So a wellness workshop, I already felt well coming today. It's really nice to have such a positive start. It's interesting because I was thinking about it when I was driving here, and the whole concept of wellness, you'd think that would be something that doctors would think about a lot, but actually we seem to get quite focused on disease rather than wellness. And so, the first topic Therese sent through was questions, wellness workshop, questions to ask your doctor. And it's interesting because a lot of patients don't ask me, how can I become well? Even though that is obviously what we all want to have, we want to feel well. But a lot of even the way we ask questions is, how's the leg weakness and how many relapses have you had? We don't ask, how many days have you felt well this year? We don't tend to ask those questions. So it's not surprising when the MS nurses did the co-design project that patients with a relapse comment that they feel better knowing they've got a doctor's appointment, but often after they've had the doctor's appointment they feel worse than they did anticipating that they might be about to see their doctor. So I think the reason for that is that it's the way that we as doctors think, and it's our focus is very much on the disease process and the treatment of the disease process. And often when we're rushing around and we're seeing lots of patients, I think we forget. And I think I've probably learned a lot out of today already myself, just that in terms of, what actually is the focus of the doctor-patient relationship? What is the focus of the patient out there in the world with MS? The focus is to become well. And so that might not seem a very big deal for you guys, but actually for me it's been just coming here has been really, and thinking about wellness is interesting. So, is this going to move? So important questions to ask your neurologist. I think depending on your neurologist, I think those of you who come to see me, I would be more than happy for you to ask me, how can I become well? I think it's a very good question. I think if you ask that question to some neurologists, they may not quite understand what you're saying. So in terms of, I think, and also I don't think neurologists are necessarily, we're not really trained, we don't have a session on how to help people feel well. So I think this talk, what I'm going to speak with you about is very much sort of the neurologist focus, and I think actually a neurologist may not make you well overall, but it's putting the neurological stuff in under the big umbrella that is your health and your wellness. And that's why all these things that Therese and the MS Society run that help promote wellness, I think are so very important, and recognising that the neurologist and the doctor's part of it is to help manage your disease and help you to understand your disease, and ultimately that knowledge and that understanding will hopefully contribute to your overall feeling of wellness. But there are so many other things beyond what your doctor says and what the disease process is that can enhance the overall concept of wellness. So today, I think under the umbrella of wellness, I think we're in quite a small part of it, but a very vital part. And certainly the better controlled your disease is, the better you understand your disease, I'm sure overall that will mean that you feel better. So, yeah, that's okay. Yep, I can do that. So mostly, I haven't got a lot of slides, mostly it's just going to be me talking to you. In terms of what type of MS do I have, it's really interesting because when I inherit patients from other doctors, often I'm left wondering what type of MS this patient has before me, even though they've been seen by another neurologist for many years. So it's not surprising to me that that's a very important question for patients. And I wonder whether it is that maybe the neurologist or the doctor hasn't understood why that might be important to people, or in terms of the sort of New Zealand, as we haven't had a lot of treatments, and so it doesn't matter from a treatment point of view, your doctor may not have felt that they needed to commit to a particular type of MS. So in 2014, now 15, the type of MS that you have is important because it determines treatment. But in saying that, now the way that we classify MS is changing. So the sort of way of thinking about it before, where you had primary progressive, secondary progressive, relapsing, remitting, now it's more along the lines of disease activity. So that's kind of the concept of relapse events and progression being two different aspects of your diagnosis that determine treatment. So the secondary progressive, primary progressive, in terms of treatment, aren't as important as whether you have relapsing or disease activity from the immune point of view, and that's because that determines treatment. So the wording has changed in the medical literature, but still most patients would be classified as having primary progressive, secondary progressive, or relapsing remitting disease. I guess from the relevance to you is when you hear your doctor say, when you hear the word progressive, it's probably quite a shock to patients who have had relapsing remitting disease and then are then being told that they've moved into the progressive phases of disease. And because in medicine there's not really a hard and fast thing. It's like there's not a test you can do. Your neurologist may well get that wrong. And so I think that the biggest problem has been for patients to actually kind of get their doctor to commit whether or not they think they have progressive disease. And my personal feeling is actually the patients probably know before the doctor does whether their disease is progressive. I might be wrong on that, but I think my feeling has been that it's such a subtle, it's often at the beginning quite a subtle change, and so I think most patients possibly know before their doctors whether their disease is progressing. And to step back, I think also sometimes the progressive diagnosis can be wrong. So when you have a lot of, if you're defining disease progression as being the loss of nerve cells, what you want to be very careful is that you're not missing disease activity from the immune system and mislabeling it the progressive form. So I think that's why this question of your neurologist, what type of MS disease do I have, it's a very difficult question, and I think that's why doctors aren't very good at committing to it. And but I do think if you personally believe that you have disease progression, and that you feel like over the course of the last year that you have gotten very slowly and subtly worse in the background, and your neurologist hasn't committed to the word progressive in your diagnosis, then it's probably something that it would be appropriate to ask them, do you think that I have disease progression, or do you think that I have accumulation of inflammation? And accumulation of inflammation at the moment is the treatable part of MS, so that's an important thing to determine. Are there any questions around that? I'm happy to answer questions, so yeah.
I'm just wondering, with the relapsing remitting, how bad does the symptom have to be for you to classify it as relapsing remitting?
So, yep. So in terms of disease activity, again, it can be really difficult. So especially when you've had MS for some time, and then you have, am I echoing? And then you have a relapse event. Often it can be hard to know what's a relapse and what's a flare of old disease. So the old damage is usually brought out by if you're sick for another reason. So if you've got a flu or you're unwell, you change medication. If it's an old symptom but it's impossible to know whether it's new or not, then the only real way to tell is to do an MRI scan. And if you give the gadolinium contrast, and it's a new lesion, it should light up most of the time. Not 100%, but most of the time.
Well, I've only known I've had it for like 5 weeks now.
Yeah.
So it's only retrospectively I'm looking back.
But yeah.
Obviously I've had it for a long time.
Yeah.
Just found out, died.
Retrospectively, relapse events are usually very typical. So it's the evolution of the symptoms. So they come on slowly. It's very unusual for a relapse to be fine 1 minute and awful the next. It's usually something that kind of trickles in the background over hours to days.
It wasn't awful. It was like, I don't even know what you call it when you can't physically do something.
Yeah, yeah. Yeah, so it's more like it is something that tends to come and it lasts for many days usually, sometimes many weeks, and then slowly gets better. So a relapse has to follow certain rules, and because relapses are so important in 2015 in terms of the determination of treatment, if you feel like you are having a relapse event, and it's not too bad and it's only been 24 hours, then there's probably no point in doing very much about it and just waiting till the next day. If the next day your symptoms are slightly worse, you're not sick for any other reason, then that's the time to ring the MS nurses or your GP.
What I was just going to say was the comment that you made about how you feel the patient knows better than the neurologist. And I think it's true because so often I think you know yourself.
Yeah.
It's not like you're 10 years old or anything.
No.
You know your own body.
Yeah.
And of course, the doctor's presented with someone they don't really know, and they just have to look at what.
Yeah.
You're living it. So I think you do know yourself you know how you feel. You know when you feel good and when you're not.
When you don't, something grumbling in the background.
Yeah, you just know.
Yeah, and I think it is a big commitment from a diagnostic point of view to say you have progressive disease there's almost no going back from that from a medical point of view. So you know what doctors are like. We like to get things right, and we sort of sit on the fence if we're not sure. And that's a good thing, in that you don't want someone throwing diagnoses around. But at the same time, if you as a patient feel that your disease is progressing and your doctor isn't hearing that or isn't able to kind of commit to that, then it does leave you kind of feeling a bit misunderstood. And it may be that they're worried that if they say that it will be a big deal. And so there's a lot to that, and I'm sure all of you in the room have had a lot more experience with that than I have.
Excuse